All right, so ladies and gentlemen, welcome to this Zoom meeting. And as you have seen over the last few weeks, it's the flavor of three. You know, we have lockdowns for 3 weeks at a time. And so we'll also have a triple combination now here. Another figure of three. And we're going to talk about soprano titanium. Stronger, faster, and smarter. This is the new hair removal system, which is in place since about a year. And I'm going to talk to you about the need for something which is simpler to use, more effective, with better results. We all know about the laser hair reduction mechanisms, which is selective photothermolysis, and then the extended theory of selective photothermolysis, then of course the hair conduction theory. And the hair anatomy, the hair follicle depths to which the hair follicles are placed, depending on the areas, whether they're looking at the chin, whether they're looking at the chest, back, or other areas. And then the laser parameters, the hair follicle absorption, the thermal characteristics, and the penetration characteristics, which means all of these are wavelength dependent. And you can see in this picture, the three most important biological targets in laser hair follicle interactions. You can see where the targets are. You can see the papilla, the hair bulb, and the bulge. Now, if you look at the triospectra, you can see where the spikes are. This is the area where we need to deliver the highest amount of energy. And look, you can see the sites. You can see how the different depths are seen at different places, the hair follicles. And remember, the deeper it is, the better it is for the 1064 wavelength. We'll deal with that a little later. Now, permanent hair reduction requires destruction of stem cells in the outer root sheet of the follicle and necessitating even longer pulse durations to allow for propagation of heat from the pigmented hair shaft to the non-pigmented stem cells. Now, although there may be vaporization or charring of the visible hair shaft, there should be no charring, blistering, crusting, or ulceration of the skin. Now, this is very important. All the earlier hair removal systems that we used to go through, especially when I started almost 20 years back, if you didn't get the energy right, if the joules were too high, then you would see burn marks. And those burn marks are actually a defeat for the cosmetology procedure because most of these burn marks will be permanent. And so therefore, there should be no charring, blistering. It means the energy levels were too high. This particular problem has been solved with the use of the triple length hair reduction system. So anti-ag lasers, please remember, are safer for reducing black hair in patients with dark skin, which means it's the 1064. It's poorly absorbed by the melanin and therefore less likely to injure a pigmented epidermis. And apart from that, we are also chilling the epidermis at about 3 degrees centigrade. Now, any amount of heat which would have been picked up with the epidermal melanin is therefore unlikely to happen. And then the laser plume can go unabated straight down to the hair follicle. Now, the therapeutic endpoint for hair removal appears after several minutes. Therefore, it's nice to do a test patch when you start with the patients. It's several minutes, but give about 3 to 5 minutes of time. The perifollicular erythema and edema are the most reliable endpoints. Please remember that. Perifollicular erythema and edema are the most reliable points. But where will you see the erythema? You'll only see erythema in patients with type 3 and type 4 skin. When you go to type 5 or type 6 skin, please don't look for erythema, look for edema. Edema is the de facto evidence that the energy has been delivered to the hair root. Now, vaporization or charring of hair may be seen with some lasers, but these are not required for a therapeutic response. You're not going to see vaporization or charring when you use the soprano titanium. So this is the journey of the milestones of the soprano hair removal system, perhaps one of the most fabulous hair removal systems that are available in the world. This is a unique leader, and you can see that they did not rest on their laurels over a period of years. They went on perfecting it till they got this. They started with the mythos, then they went to the sopra, then the soprano XL, then the soprano ice. So this is a very popular system. But they did rest on their laurels. They went on to the soprano platinum, and from there now they have come to the soprano titanium. Here are the wavelengths. You can see the triple wavelengths is the soprano, the trio. So which factors determine good hair reduction, good laser hair reduction? Which factors? Okay. Now the hair removal efficiency, the factors are the type of the skin, the hair type, light hair, dark hair, the hair growth system, the hair topography, the ethnicity, the gender, the age, and the hormonal background. Now, this is one of those slides which I never tire of showing over the last several years, and that when you have a look at when you have a system and you look at the testosterone levels, the LH-FSH levels, and the DHEAS levels, please remember, if these patients go to a gynecologist, the gynecologist will say that the hormone levels are normal. So, but on day 5 of the cycle, if they go and get their blood examined, and look at the LH by FSH ratio. The LH by FSH ratio, if it's more than 0.67, then it means you are having a mild polycystic ovary disease. If they're very high, the testosterone levels, then please look for ovarian tumors. And if you look at the 17 hydroxyprogesterone levels, you can evaluate these too. If the DHEAS is increased, then please look for the adrenal. That's very rare. The most important here is the polycystic ovary. The reason behind this is when patients come to you for the first time, they will show a normal blood profile, the hormone profile. That's actually very deceptive, because 6 months down the line, if they do not have a satisfactory hair reduction, they will curse you and they'll curse the machine. They'll give you a feeling that the whole thing was not worth it. But this is the time you must do another blood test. And if you see that the LH by FSH ratio has changed, that they can tell the patient, look here, the reason your hair follicles are getting reactivated, new hair follicles, those which are gone, but the new hair follicles which are getting activated are those hair follicles which are getting stimulated by this new increase in your hormone levels, especially because you're now a mild polycystic ovary disease patient. This is the diagram of the anagen, catagen, and telogen hairs. You can see the percentages here on this. Very self-explanatory. And then you have the wavelength of 3 in 1. You see, the one nice thing about the soprano titanium is that it's a large 4 square centimeter hand spot size. This is huge. The idea of having such a large spot size will be appreciated by you if you start doing upper back or the whole back, chest, legs, thighs, arms, and you'll find that the job which should only take a couple of hours earlier to do is probably going to get done now by 45 minutes to 1 hour. So you have a combination of 755 and 810 and 1064 simultaneously targeting different tissue depths and anatomical structures of the hair follicle. So you make sure you tackle the bulb, you tackle the bulge, and you tackle the papilla. And the laser wavelengths, the depths and the targets are here. You see, the 755 takes care of the most superficial component, the 810 is in the middle, and the deepest set hair follicles are the 1064. So since the energy is equally divided among the 3, you're addressing hairs at all 3 levels. So why super hair removal? What is this concept of super hair removal? The idea of this super hair removal is that you do not deliver the energy like some of the other machines do, one big bang, like just releasing a rubber band. You stretch a rubber band and release it. That's very painful. It's all energy being delivered in one bang. That doesn't help a lot. What you need to do is use a low fluence and high repetition rate. So the total energy delivered would perhaps be the same or even a little lesser, but then you have a low fluence, so the energy levels build up in the hair follicle and around that area, till the hair follicle is destroyed. So high repetition and a low fluence rate. These two are very important. And now you see the repetitive movement of the applicator. Is this the video? Repetition of the applicator, and you can see how the video plays. Hang on till the video starts. There you are. You see.
Sir,
So there you are.
so it's not getting played, is it?
Sorry.
So the plays. I mean, you can try again.
Okay. So you can all hear me, right?
Yeah. We can hear you.
Until we get this thing organized now for the next slide, what I'd like to tell you is that a couple of things the patients ask. The first thing they ask is, doctor, is this painful? And then they know that this is not painful. When you tell them that this is like a hot stone massage and that you'll be very comfortable, they're relieved. The first factor that they look at is once they negotiated the price. That's what I mean. Once they're happy with the price that at which you're offering it to them, the first thing they ask for, doctor, is this painful? And the second thing they're going to ask you is, doctor, does this cause burns or scars? Now, if you say with great confidence that you do not get any burns or scars and that is not painful, it's very comfortable, that's it. That will take very little time after that for the patient to decide to go ahead with the laser. So the Ice Plus continuous cooling system is an advanced technology that continuously cools the skin throughout the entire treatment to -3 degrees centigrade. So the cold sapphire tip minimizes risk of burns. This is very important. When you cool the skin down, the chances of the burn are minimized, because what are you cooling? You're cooling the epidermis and the upper part of the dermis. That is not where the hair root is. The hair root is around the mid dermis or lower dermis. So as the laser energy passes down, it's not going to damage the upper part of the skin. And also, of course, improves the applicator's efficiency and the life of the equipment. Why triple wavelength for hair reduction? So the trio provides a clustered polychromatic laser technology for maximal laser skin hair follicle interaction and photobiology coverage. And the trio improves melanin absorption spectrum by 25%. So it improves the heating, it improves the skin penetration, and it targets wider range of hairs at different anatomical locations for most skin hair biological conditions. So you're going to get the highest average power which is required for an effective laser modality for all skin types. Now, a question a lot of people asked at every conference is, what is the ideal wavelength? See, there was a lot of discussion. There were people who were swearing by 755 earlier. Then there were people who are talking about the 1064, because the 755 was very popular in the Gulf region. The 1064 also has been popular around the world. The 810 is the standard barrier of hair removal in our country. But now that you have this triple combination, you will make sure that the hair root cannot escape. You see, you have all three wavelengths targeting the hair follicle. So there, in this picture, you want to see what is targeting what. You see the bulge, the red line, the pinkish red line, I would say, and the light blue line, which is the 755. There you can see that, and the 810, and the papilla below you can see the 1064 at the hair bulb region. So everything is addressed here in this particular the targeting. And so why titanium? That's the next question people are going to ask you. Why titanium? Well, why titanium? Because you can see that there are a lot of features. You have an Android screen which has preset parameters and user-friendly screen. You have a smart clinic cloud-based business development tool for real-time data access. So you can access a lot of data on what's actually happening, how many patients have come, what's the energy delivered to date. You need not be in your clinic. You could be traveling around the world. Of course, now it's not a reality to travel around the world. But when you do eventually travel around the world, you can track actually what's happening with your machine. Dual connectors, you have two different applications, two platforms connected. And you can see the, what else are you going to have? You're going to have speed with the 810. It's compact, light and lean, and it's got a lot of power. You can see the combinations here, trio. The Quattro, 4 centimeters square, and these are clinically prone. Remember, there are a lot of papers on hair removal with the soprano. Because initially, when this concept came with low fluence and high repetition rate, people couldn't believe it. They said, how can you have this? This is instead of one big, huge slap on the face, these were multiple small slaps which were painful, which were painless, but doing the same job. So the clinical studies show that soprano has been the subject of multiple studies, yielding lots of results with less pain and much safer, particularly for darker skin types in our country. And you can see, apart from other papers, I had an original paper published way back in 2011, 9 years ago, with Dr. Pavitra and Dr. Malya and Dr. Michael Gold, in which we actually showed that the safety and efficiency of low fluence, high repetition rate versus high fluence, low repetition rate. You could see when you did a split phase study, you could see that there was hardly any difference. And the patients preferred this because it was virtually painless. They were very comfortable. To the extent that some patients said that, doctor, we actually feel so relaxed when this is being done because there's no fear of pain. So the clinical results, now you can see the, I mean, this can be shown by anyone. The hairs here, and you could even wax or thread and say that the hairs are gone. Therefore, there's no point in showing you pictures of the patients I have done. And this is a picture which is provided by the company, but whatever picture I had would be the same thing. And if this man were to go to a beauty parlor and have everything waxed and stand and say, look here, everything's gone, and fit it into some machine, they would have said, oh boy, it works very well. But the issue is this, when you are doing upper back, lower back, chest, especially in patients who are very hirsute, the results are brilliant. There's hardly any pain. The patients come back, and not only for more, they also bring in a lot of referrals. Remember, if something works very well, works very quickly, and works without any pain, nothing is a better advertisement than that. You see, now, you know, there are a lot of Zoom meetings going on. How are we going to build up our practice? What's going to happen after lockdown? It's kind of hard to say. You know, everybody is having his pot shot, his guess. But effectively, you can see what's happening. Everything may go down by 30%. But what is going to survive? Quality is going to survive. Things which are ordinary, things which, you know, are having results which are dicey, these are not going to survive. Weaker businesses are not going to survive. People with larger loans are not going to survive well. Weaker laser machines are not going to survive because it's no longer going to be, you know, a trade-off of cheapness. It's going to be a trade-off with efficacy now. Patients are going to say, that's a machine which works well, and I'm going to get it done on that. There you are, before and after here of another patient. It is quite impressive when you look at these pictures, legs. And you could have done these legs in 45 minutes flat. Now, so the titanium edge, the only A-grade trioclustered diode wavelength in the market, most effective. The 4 centimeter square size is nobody has. Absolutely quick and painless. The 600 square centimeter to 900 square centimeter grid coverage in less than 2 minutes. Peak power is massive of 1200 watts, and a full body treatment in less than half the time. So you can see how quickly and how efficiently you can do the job. Now this is the thank you from the company for you people having listened, and thank you from my side for having tuned in this morning to look at the soprano titanium, very simply hair removal reinvented. Now, if there are any questions, we'll be happy to answer them.
Sir, so there are some questions in the chat box which I'll be addressing, sir. So
Okay.
primarily, sir, they want to know, in your experience, how many sessions do you have to deal with in patients? Since you're using the triple wavelength, sir, is there any reduction in the sessions, or there are your average number of sessions primarily, sir?
Yeah, see, now there are two kinds of patients in this. You have patients who have polycystic ovary disease, and you have patients who don't have polycystic ovary disease. Now, in patients who have polycystic ovary disease, it's kind of hard to say. Those who have severe polycystic ovary disease, or those who are having a large amount of hair growth, you have to be wary. See, the answer to more hair ultimately is more laser. But what really happens is that I have found a reduction of 25 to 30% compared to the other machines that I had. That's the reduction. So if you have what would be done in 9 sessions by other machines will perhaps be done in 6 sessions by this machine. I'd put it that way. But that is assuming that it's a mild polycystic ovary disease. If it's severe, then you'll have to go along and you'll have to have an endocrinologist addressing that part of it. But for those who are not having any polycystic ovary disease, I'd say that what could be done in about 7 sessions in other machines would be done in 5 sessions by this machine. So take about 20 to 30% reduction in the number of sessions. Good question. Next.
Sir, experience. This is a triple wavelength, and we have wavelengths like 755, 810, and 1064. Have you observed any complications on the Indian skin type?
No, I have not observed. See, this is the beauty of this whole machine, because all 3 are participating in tandem together. You are not going to blast the skin. You're not going to blast the hair roots. You're delivering energy over a period of time in a grid, 600 square centimeters or so. You're delivering it on a grid. You're using low fluence, low energy, but you're using it for an extended period of time until the total amount of joules delivered is the same as would have been delivered by other machines in one go, which would have made it very painful and led to blistering or burns or scarring. Patients, thinking that, somebody is targeting them with, one of those, kids play with rubber bands and sting you, that kind of a pain. So please remember that. It is impossible to see burns with this machine, because the energy levels are so set that you cannot cause a burn in any patient. I've never seen a burn with this machine. I've been using it for more than a year now. We had a huge number of patients, and interestingly, I have other machines here too. But if you rotate the patient around all the machines, when they come back for the subsequent sessions, they choose the soprano titanium and say, "Doctor, I'm most comfortable with this, sir. Please let me go ahead and use this."
So the next question is, do you combine eflornithine cream?
I can't hear you.
So do you combine eflornithine cream in your LHR patients with hirsutism and PCOS?
Never, never, never. Please remember that. There have been studies on this too. Eflornithine, if you look at the literature, I was told this by a patient about 4 years or 5 years back. The young lady came here for hair removal, and she had been applying eflornithine earlier. She had come from Dubai, I think. And then when she delivered a baby, the baby was a Mongol. And she came back to me and said, Doctor, see, it's written in the literature, there have been a few cases of Mongolism which have been reported. Because at the end of the day, you're using a hormonal product to reduce the hair. What's the point? I mean, you're retarding the hair, and then hitting it with the hair removal laser. It doesn't work. Let the hair grow the way it grows. So there are two reasons why I would not use it. First is the rare chance that there may be, a woman who's in the childbearing age may develop fetal abnormalities, and we don't need that because that is a very sad thing when it happens. And the patient herself showed me the literature. The literature in the Florentine thing showed that there had been a few cases. The second thing is it's pointless to try and retard the hair growth when you actually want it to come out. But because you remember very thing, if you use eflornithine, what's going to happen? It's going to retard the hair growth. It's also going to make sure that the hair which comes out is smaller and thinner. And you know very well that the thicker the hair root, the better the damage to it. So they're contradictory things. So please do not use those things. I will not use it at all. I never used it. But that's a good question. Please remember that.
So there is another question on the same lines. Do you advise OC pills in your LHR patients?
Well, that I leave to the endocrinologist. See, the endocrinologists, when they have a polycystic ovary problem, then I no longer handle that, because I often find that we are not trained in tuning the hormones, are we? In fact, we don't even send it to a gynecologist because gynecologists also don't know how to tune these hormones. Only the endocrinologist tunes these hormones. So I leave the whole thing to the endocrinologist. He decides what is going to be put into these patients and if it's necessary. But when the polycystic ovary disease is moderate to severe, then the endocrinologists are going to use hormone intervention, no doubt about it.
So also for smaller body areas like the corners of the lips, is there any special parameter or any protocol required?
I don't do this too much now. I leave it to my trained staff, which have been very well trained by Alma themselves. But you have now small attachments which will do the areas which are above the eyebrow or at the or the tip of the nose, side of the nose, or around the angle of the mouth. So there are small tips available. Please show it to them when you have it. Tiny, tiny tips. The curved tips. They are also very good for ear hair removal. Yes, they're available. They're with the company and they supply to the machine. Because you can't use the larger handpiece for this. You're going to burn the patient, aren't you?
Sir, the next question. This is coming from Nepal, sir. The doctor is using Soprano Ice Platinum, which is also a triple wavelength. She's treating the hairline. She feels that in 2 sessions, theoretically, the result should come. However, it's been 7 sessions and she's not achieved the response. And the doctor is using the stack mode.
Stack mode. Okay, so you have to split this into many things. You want to know why the machine is not working, right? On this particular patient. The question I'd ask is, what's happening when she is using this machine on other patients? Is the same thing happening, or that she's getting good results on the other patients?
So this has
That's
come
important, because
right,
if
sir.
other patients are getting good results and this patient is not getting good results, the chances are that this patient needs to be assessed by an endocrinologist and put on appropriate treatment, because there's a strong stimulus to hair growth coming out. This is my explanation. Otherwise, it means somebody has to be sent from Alma, from Mumbai to Nepal to service the machine. One of these two things. The third thing, of course, you have to make sure that the technician who's using this machine on her behalf ensures that there is very good contact between the skin and the laser head, the handpiece.
Right, sir.
Yeah.
Sir, in your experience, how many sessions, how much reduction have you seen in 8 to 10 sessions?
8 to 10 sessions of a normal patient, I would get around 70 to 80% reduction.
Sir,
And
and
if it's a PCOD patient, I'll probably get around 60 to 70%, about 15% less.
sir, in your take, do you feel a better difference in the fine hair? Do you find any resistance on the while treating the fine hair with the triple wavelength vis-a-vis the single wavelength?
No, I find the triple wavelength works better for fine hair. The 755, in fact, is designed for that. It
Right.
does work much better, the 755. But then there are other powers too, that the 810 and the 1064. So I would see very good results with this.
Sir,
However, it never goes down to zero. Please remember, I mean, there are a lot of young dermatologists who sell it as a machine for mm, instead of hair reduction, which is the actual thing. They'll say that we'll do a permanent hair removal. This is a permanent hair reduction. Patient should be happy with around 80% hair reduction, which is anything beyond that. You see, I'll tell you what happens. I had a lot of patients. We think they're happy when they come in. We see 80% hair reduction, and we are happy. But they don't see that. You know what they do? They hold a mirror like this. If you can show that, 3 or 4 inches. Have a look at the hair, and then come and say, "Doctor, see, I can still see some hair." Now that's not a social distance. Today we are talking of social distancing, right? The social distancing for corona is 6 feet. The social distancing for hair reduction, hair removal, whatever, is 3 feet. Nobody allows anyone to come closer than 3 feet. Okay? So from a distance of around 2 to 3 feet, if the hair is extremely prominent, that's another story. But there are a lot of patients I've seen, they hold the mirror very close to the chin or to the upper lip and say, "Doctor, look, I can see the hair there." So from a social distance, which is the word which is playing around the whole world now, social distance, you should tell them, "Look here, when you used to come here 4 months ago or 6 months ago, I could make out that you had a very thick upper lip hair growth and that you had come for hair reduction. Now, when I rest my eyes on your upper lip or chin, there's hardly anything I can see. If you come very close and show it to me, that's another story, but that's not social distance. So you have achieved the hair reduction which you set out to achieve." So that's very important for us to counsel them right at the beginning, that 80% is the best you can get and no more. But I'll tell you what happens. There are a lot of patients who initially think that the hair reduction is not 80%, that it's even more than that. That's not true. So counseling them at the beginning itself is very important, that what you're going to achieve is around 80%. And then what about the other 20%, you'll ask me? Well, the other 20%, they have a choice between threading it themselves or going to a beauty parlor or coming to us for more hair sessions. So what I normally do after 8 to 10 sessions is that I level it off and say, "Look here, the answer to more hair is more laser. And so instead of going to a beauty parlor and getting it off, you come here for a price which is slightly higher than what the beauty parlor is going to charge you, and then get rid of these hairs." Because over a period of time, as you know, over the next half a dozen sessions, even the fine hairs start going, and then the patient is very happy. So this is, you front load the costing of the hair removal laser over the first half a dozen sessions. And then you reduce the rates so that it comes down to more acceptable levels in the patient. And then finally, after you're done 10 sessions, you make sure that you have a competitive pricing for the mop-up sessions of the thin hair, which will prevent them from going to beauty parlors. Am I clear on that?
Yes, sir. Sir, in paradoxical hypertrichosis, have you seen any patients, and how do you manage them if you in your practice?
Well, one of the things that I see is not everybody gets a paradoxical hypertrichosis. There's only one set of patients who seem to get it. We really don't know how and why. One of the things you need to do is to use much larger energies in the first 3 sessions. This is something I have seen, that if you use more energy in the first 3 sessions, then the chances of a paradoxical hair growth become less. However, you warn the patients that one set can get paradoxical hair growth, and if they get a paradoxical hair growth, you include that area in your hair removal. That's it. So if they come for a chin and upper lip, and you see that on the sides of the cheeks you find more hair popping up, which is paradoxical hair growth, then you have to address that too. Perhaps because you have smaller amounts of energy which are dissipated, they stimulate the hair there. But the answer to more hair again is more laser. That's it. Right. Any other
Sir,
questions?
yes, sir. A few more, sir. So fine hair on the lower lip, in doctor's experience, it never goes down, even with the Alexandrite 755 nanometers. So have you experienced this as well?
You mean under the lower lip, is it?
Yes, sir.
Yeah, that's true. That's an area which doesn't work as well as the other areas. That's one of the limitations you have.
So then
But
there is one.
but with the smaller hand piece which you use, for the ear hair and the eyebrow hair, you tend to get much better results with this too.
So with regards to paradoxical hypertrichosis, another doctor wants to know, there are various modes in the soprano. So do you feel it is more in the SHR mode vis-a-vis the HR mode, or both are
Paradoxical,
equivalent? So the
the
chances can be with
paradoxical,
both.
the paradoxical
Yes, sir.
hypertrichosis. Oh, okay.
Yes, sir. Is it
Yes.
mode related?
Well, that is true to the extent that when you use the stack mode, that's what you mean, the stack mode, right? Stack mode
So
versus
the
SHR mode, right? Stack
stamping
mode,
mode versus the SHR
yeah,
mode.
the stamping mode is perhaps the best for the upper lip. It's true, but you can't use the stamp. You see, the whole idea of using an SHR is to make life more comfortable for the patient, save time for the patient, do the job quickly and very effectively. So the SHR mode is used as far as possible. And in areas like the upper lip, yes, because the area is very small, you can do it reasonably quickly. You can use the stamping mode, but I have never gone to the stamping mode. You can do one thing if you like. You can do the SHR mode, and then you can mop up later on with the stamping mode. See, first thing is to debulk the hair. Let's say you're starting with 10,000 hairs. You can't go on the stamp mode unless you have one patient a day. You do the whole thing with an SHR. Over the next few sessions, you get a huge hair reduction of say around 50 to 60%. Thereafter, you can go to the stamping mode if you like, because then the time is saved. But there's no point in having the upper back or the chest being done on the stamping mode. It never takes you anywhere.
In
The
what
idea
age
of
group
having
do you
these kind of
advise laser
machines.
hair reduction?
Sorry.
Sorry, please go on, sir.
Yeah. So the idea of having this kind of machine
Hello.
is you see, if you have a large hair practice and finicky patients who are worried about pain and you want great safety, then you have to go by the SHR mode. That's it. It's a tried, tested, proven technology which has been around for more than a decade.
Sir, at what age do you recommend a laser hair reduction? Today, with the peer pressure, children at 10 to 12 years want to start with laser hair reduction. So, what is your opinion on this?
I don't know how that's going to change post-corona because I was just telling the other day somebody, what do you do with patients who come for radio frequency skin tightening? I said belt tightening is going to be more important than skin tightening now. So there are chances that women who would have earlier jumped in with their teenage daughters for hair removal are going to come now a little later. But having said that, quite a few teenage girls, you see, we see this mostly in the northern region of the country. In the northern region of the country, you would see mothers and daughters commonly coming together, teenage daughters, and mothers coming together for hair removal. That's an odd. But in the south, there's less of this Hirsutism problem, and so they are more likely to see girls coming maybe around 18, 20. But I have patients who have come here who started hair removal as early as 13 or 14 years of age. There seems to be no contraindication for that because it's not an invasive procedure. There are no burns. The children are, the teenagers are comfortable when it's being done. So I guess there is no particular age bar, but I do not do it. And if somebody were to come and say, my daughter is 10 or 11 and you please do it, no. I would wait till they're at least 14 or 15 before I would go and do a hair removal on their chin or upper lip.
So there is another question on the
I
hormonal.
have done it on one child of 8, please remember that, 7 or 8, which is referred from my medical college for congenital adrenal hyperplasia. Poor child, that girl child had massive hair all over, and I had no option. And she responded very well to it. After multiple sessions, we saw that the hair had gone down significantly. Yeah, any questions?
Yes, sir, many more, sir. So this is again related to the PCOS. So despite dermatologists referring to endocrinologists, some endocrinologists just suggest lifestyle modifications. Have you experienced this? And if yes, then so what is or how do you
Yeah,
manage such patients?
lifestyle modification that's all. But when you have a borderline polycystic ovary disease, then obviously, I'd be happy to have an endocrinologist who says, please modify your lifestyle, don't get onto more drugs, because essentially any drug which is given to tame the hormones is also a hormone, isn't it? They're hormonal drugs. So if you have an endocrinologist who says, please fine tune your lifestyle, okay, get your weight down, that's one of the most important things, right? You pump more hormones when you're obese. So I would admire an endocrinologist who said, look here, let's give it a chance. You drop 10 kilos of weight and come back to me. And if you still have the issue, then I'll put you on medication. So I'll be happy with that. In fact, that's a conservative endocrinologist who's not looking for money.
So also post 5 to 6 sessions on the full body, when some medium coarse hairs stay behind in few places, do you use the dynamic mode or the stamping mode is the question.
I'd use the
So the
stamping mode.
SHR mode versus the stamping mode.
You can use either. You see, there's no particular thing, but my staff who do it prefer the stamping mode because I think that becomes much easier for them to do, stamping mode, because they're targeting these specific areas.
Right.
You see, there's another thing you must remember. Patients who are coming for upper lip and chin hair and face hair are looking for a full-blown massive reduction of hair. Right?
Right.
They want 90%, 100% to be gone. But patients are coming for chest, upper lip, back. All of these patients, they're not looking for a full reduction. They would rather have a lightening of the hair. There are patients who come to me and say, doctor, I don't want all the hair removed on my back or chest. This is men. Get it down by 60% so I look like other men. I don't want to be totally hairless. But then you have girls who come for leg hair who say, I want it out as much as possible. And then you have patients who have folliculitis on the hair, pseudo folliculitis, because of thick hairs which curl in. And that's a medical problem, and you have to do that too. Yeah. Next question.
Sir, is there a difference between the overall final response with the soprano ice or titanium, leaving the difference in the number of sessions required considering difference in the price between the two? So, sir, both are priced differently. Other than the reduction in the sessions, any other difference that you find, sir?
The efficacy is better. There's no doubt about it. Look, it's the difference between going by a Kia car, a Kia SUV, and a BMW SUV. You'll get there, but when you use a soprano titanium, you get there in style. That's the difference. Quicker, faster, less painful, more efficient. Everything is more perfect. It's a question of choosing something which is good and choosing something which is excellent. So if your budget doesn't fit a titanium, then you can go for you still have the platinum, don't you? Then you can go for the, Preeti, you still market the platinum here, or it's only the ice and the titanium?
So we are doing all three: the ice, the
Yeah, so,
platinum, and the titanium.
right, so, yeah. So the difference between good and better and best, is the difference between the ice, the platinum, and the titanium. So there's no fixed thing. You have to fit your budget onto that. That's it.
So do you recommend hair reduction in keratosis pilaris? And if yes, do you
Now
have some
look,
special
these are all
protocol?
smaller and smaller and smaller.
Right, right, right.
I mean, you can
Yes, sir.
answer
Yes,
these
sir.
questions when the cows
Sure,
come
sir.
home. Yeah,
So
I mean,
just one.
we'll go past. See, you'll have one keratosis pilaris coming in,
Right.
in a couple of months, and that 90% of the time he would like the hair removed. But then if you do it, there's no harm, right? If there is a hair which is seen and can be removed, so be it. Remove it.
Sir, I think one last question.
Please, let's make
Post-COVID,
that the
sir.
last question. You're right.
Right, sir. Post-COVID, sir, will you restart with LHR? And if yes, then what precautions will you follow?
Oh yeah, you see the standard precautions which are used for all COVID. The first thing is in the consent form, you must take a consent that if the patient develops corona, that we are absolved of any responsibility, because there's every chance the patient will say that, look here, I came here, I got it done, and somebody in your clinic infected me, right? So you have to ensure that you have it written down in the consent form, which is very important. And then thereafter, another important thing is, before the patients come in, if they have any cough or cold or sneezing or whatever, they must first go and get themselves checked in a hospital with a pulmonary physician, ensure that there is no corona before they come in. And then those who come here, of course, we're going to tell them to use the standard sanitizing processes. And if they're not doing the face and chin, they might as well have their mask on when the thing is being done. Like if you're doing upper lip, or if you're doing upper lip hair, you can't have the mask on. But if you're doing chest or body hair, you can have the mask on. And of course, make sure that your staff also uses the mask. That's very important.
So, sir, the questions are keeping on coming in, but I
Yeah,
think
but no, we'll probably take
yes, sir,
two
we'll
more
have
questions,
to.
Preeti, because
Okay, sir. Thank you.
I need,
Thank you, sir. So, sir,
yeah.
there are exactly two more questions. After 10 sessions with 80% reduction, do you suggest using only Alex is better of soprano, sir?
After 20, sorry?
So after 10 sessions with 80% reduction, do you feel using alexandrite only is better in soprano?
No, I would not do that. On its own, I have not found the 755 to be so effective in Indian skin, because our hairs are, you see, this is more important in Gulf region where people have finer, thinner and lighter colored hairs, or in the US. We have darker hairs. So please use, if you rate it in terms of efficacy, 810 is the best. Then there's 1064, and then finally the 755. So I would not use the 755. I would use the 810, which would be perhaps better than the 755 in Indian conditions. But if I was practicing in the Gulf, I'd probably use the 755, because patients there find better results with the 755.
So just the last question, and genuinely the last question, sir. Do you do a lot of beard shaping in your clinic, and any special parameters that you follow for it?
No, we do not do a lot of beard shaping in our clinic. We have the occasional patients who come here we just calculate the area to be done and the energy to be delivered in that area. And it's very important that the patient marks the beard. We have had patients, you mark it for them, and then they're never happy, saying, no, it has gone too far, and then you can't retrieve, you see. So it's important for the patient to carefully mark the area of beard hair which needs to be removed, and then we remove it.
Thank you so much, sir.
You're welcome.
Thank you so much, Dr. Ganesh Pai, sir, for this wonderful session and for sharing your experiences with us.
And I must thank
Thank
you, and I must thank the audience for having spent one useful hour of their time in the morning. Thank you very much, wherever you are. Good afternoon, and God bless you all. Thank you very much.
Thank you, sir. So thank you all our doctors for coming and attending this webinar. For any other questions, you can write to us or call us up. I will share the email ID with you on the chat group. You can reach us over there.
Thank you.
Thank you, sir.
Thank you.